Have you ever handed your elderly parent or grandparent a common painkiller, thinking it would help them feel better, only to unknowingly put them in serious danger? Here's the uncomfortable truth. After age 65, the body's ability to process medications, especially painkillers, dramatically changes. What used to be a harmless over-the-counter pill can suddenly trigger internal bleeding, kidney failure, confusion, or even a life-threatening fall. Every day, thousands of older adults reach for the wrong bottle without knowing the risk. And many of them pay the price, not because they made a mistake, but because no one ever told them what's safe and what isn't. In this video, we're going to reveal 5 types of painkillers that seniors should never take. These aren't rare or exotic drugs. They're the exact ones you'll find in medicine cabinets across the country, often taken daily by people who think they're playing it safe. If you or someone you love is over 65, you need to hear this. The next few minutes could prevent a hospital visit or save a life. Before we dive in, don't forget to hit that subscribe button for Life in Words. We bring you essential health tips to help seniors live longer, stronger, and with dignity. Are you ready? Let's uncover the truth that pharmacies won't warn you about. 1. The hidden danger of over-the-counter NSAIDs, Ibuprofen, Naproxen. Let's start with one of the most commonly used painkillers in the world, NSAIDs, or non-steroidal anti-inflammatory drugs. These include ibuprofen, Advil, Motrin, and Naproxen, Aleve. Millions of people use them daily to relieve headaches, joint pain, backaches, or even the occasional toothache. But if you're over the age of 65, these medications can turn deadly. Here's why. As we age, the lining of our stomach becomes thinner, and our kidneys work less efficiently. NSAIDs irritate the stomach lining, increase acid production, and reduce protective mucus, creating the perfect storm for gastric ulcers, bleeding, and even life-threatening gastrointestinal hemorrhages. Worse still, NSAIDs can reduce blood flow to the kidneys, especially in seniors who are dehydrated or already on blood pressure medications. This can lead to acute kidney injury, which often goes unnoticed until it's too late. And if you're already taking aspirin or blood thinners, combining them with NSAIDs dramatically increases your risk of internal bleeding or stroke. Consider the story of Mr. Harold, a 79-year-old retiree who began taking ibuprofen twice daily for knee pain. After just 1 week, he was rushed to the ER with black stools and dizziness, classic signs of a GI bleed. Doctors traced it back to the NSAIDs he assumed were safe. So what can seniors do instead? Doctors recommend acetaminophen, Tylenol, at the lowest effective dose, applying heat therapy, or consulting with a physical therapist for non-drug alternatives. Have you or someone you love ever taken ibuprofen or naproxen regularly after 65? Comment 1. If yes, 0 if no. Your response might help others stay safe. 2. Opioids, a silent risk for seniors. Tramadol, Codeine, Morphine. Opioid painkillers, such as Tramadol, Codeine, and Morphine, are often prescribed for severe pain, post-surgery, advanced arthritis, or cancer-related discomfort. They're powerful, and in the right setting, they can be life-saving. But for older adults, they can also be life-threatening. Why? Because as the brain and body age, they become much more sensitive to sedatives and narcotics. Opioids act directly on the central nervous system, and in seniors, this can lead to extreme drowsiness, confusion, dizziness, and disorientation, making even simple tasks like walking to the bathroom incredibly dangerous. One of the most serious consequences? Falls. A fall that might be minor at 40 can be devastating at 80. Fractured hips, brain bleeds, and permanent disability are all too common among seniors using opioids. Opioids also cause constipation, which might sound minor. But in older adults, it can spiral into abdominal pain, loss of appetite, and dangerous intestinal blockages. Some opioids, especially when combined with sleep aids or anti-anxiety meds, can suppress breathing, a silent killer, especially at night. Take the case of Mrs. Carolyn, age 82, who was prescribed Tramadol after a minor dental procedure. Within 2 days, she became unsteady, fell in her kitchen, and fractured her hip. Her recovery took nearly 6 months, all from a drug meant to help. So, what's the alternative? Doctors suggest non-opioid options first: acetaminophen, physical therapy, acupuncture, and mindfulness-based techniques. When opioids are absolutely necessary, they must be used in the lowest possible dose, for the shortest time, and under close medical supervision. Have you ever seen someone struggle with the side effects of opioid medications? Share your thoughts or experiences in the comments. Your story could help someone make a safer choice. 3. Multi-ingredient painkillers, a risky cocktail for aging bodies. Painkillers like Excedrin, Panadol Extra, and other extra-strength formulas might look harmless on the surface, but they often contain a mix of multiple active ingredients, including caffeine, aspirin, acetaminophen, or even antihistamines. These combination drugs are designed for quick, powerful relief, but for seniors, they're a ticking time bomb. Let's break it down. Caffeine may seem innocent, but in higher doses, it can cause heart palpitations, increased blood pressure, restlessness, and insomnia, especially in individuals who are already sensitive or take medications for heart disease. Combine that with aspirin, and you've got a serious risk of gastrointestinal bleeding, especially in those over 65. On top of that, mixing active ingredients increases the chance of accidental overdose. For example, someone might take Panadol Extra for a headache, not realizing they've already had acetaminophen earlier that day, pushing them dangerously close to liver toxicity. Even more concerning, these drugs often interact with antidepressants, blood thinners, and blood pressure medications, a deadly mix if not carefully managed. Take the example of Mrs. Eleanor, 75, who began taking an over-the-counter migraine pill with caffeine and aspirin every evening. She hoped it would help with her evening headaches, but within weeks she developed elevated blood pressure, insomnia, and gastric pain, all traced back to the safe painkiller she thought was helping. For older adults, less is more. Single-ingredient medications are far safer and easier to monitor, and if pain is persistent, it's always better to consult a doctor than layer on risky combinations. Have you ever checked how many active ingredients are in your painkillers? If not, now might be the time. Comment, "I will check," if this was new to you. Let's raise awareness together. 4. Aspirin for pain, a common mistake that could turn dangerous. Aspirin has been around for over a century, and it's still widely used. Many people, especially seniors, keep it in their medicine cabinet for headaches, toothaches, or body aches, assuming it's gentle and safe. But here's the harsh truth. Aspirin is not a harmless pain reliever, especially not for people over 65. Aspirin works by thinning the blood and blocking pain-causing enzymes. That may sound helpful, but in older adults, this can greatly increase the risk of internal bleeding, including bleeding in the stomach, intestines, or even the brain. If you're already on blood thinners or have high blood pressure, the danger multiplies. A common scenario? A senior takes aspirin for knee pain while already on medication for atrial fibrillation. They may not feel anything at first, but days later, they're rushed to the hospital with signs of gastrointestinal bleeding or unexplained weakness from internal hemorrhaging. Another risk: many seniors are prescribed low-dose aspirin for heart protection and unknowingly take additional aspirin to manage everyday pain, doubling the dose without realizing it. Consider Mr. Joseph, 77, who took baby aspirin every morning for his heart and added a regular aspirin tablet at night for back pain. Within weeks, he began experiencing black stools and lightheadedness. The cause? A slow but dangerous GI bleed from too much aspirin. What's the safer route? For pain relief, doctors recommend acetaminophen, Tylenol, as a first-line option for seniors. And if aspirin is prescribed for heart health, it should never be doubled for pain relief without medical approval. Have you ever taken aspirin thinking it was the mild option? If this section surprised you, comment, "I didn't know," because your comment could help others think twice, too. 5. Topical pain relief gels, harmless or hazardous? When oral painkillers feel risky, many seniors turn to something that seems safer: pain relief creams, gels, or patches. These topical solutions often contain ingredients like menthol, methyl salicylate, or capsaicin, and promise fast relief from joint pain, arthritis, or muscle stiffness. But here's what few people realize: topical painkillers can still be dangerous, especially for older adults. Aging skin is thinner, more fragile, and more absorbent. That means the active ingredients in these creams can enter the bloodstream faster and in higher amounts, leading to potential systemic side effects, especially when applied too often or over large areas of the body. Menthol and salicylates, for example, can cause burning sensations, skin peeling, or even chemical burns in sensitive seniors. And in rare cases, overuse can lead to salicylate toxicity, especially if used in conjunction with aspirin or blood thinners. Let's look at the real case of Mrs. Dorothy, 81, who suffered from chronic knee pain. She applied a menthol-based gel 4 times a day for weeks, thinking it was safer than pills. Eventually, she developed red, irritated skin that blistered, requiring dermatological treatment. Her doctor later confirmed she had absorbed too much salicylate through the skin. Another risk? Many seniors don't realize that using heat packs after applying these creams, a common habit, can dramatically increase absorption, turning a minor treatment into a toxic dose. To stay safe, topical pain relief should be used sparingly, only on small areas, and no more than 2 to 3 times a day. Always wash your hands after applying and avoid layering with other medications unless directed by a physician. Have you or someone you know had a skin reaction from a pain relief gel or patch? Comment yes if you've experienced it, or no if not. It helps others learn what to watch out for. Conclusion: a small pill, a big risk. By now, you've seen the hidden dangers behind some of the most commonly used painkillers. From NSAIDs like Ibuprofen to deceptively gentle aspirin, from opioid prescriptions to multi-ingredient formulas and even topical creams, what seems like minor relief can quickly become a major health crisis for seniors. The truth is, aging bodies don't process medications the same way they used to. A drug that once worked at 40 could be harmful, or even fatal, at 75. The margin for error shrinks with age, and awareness becomes your greatest shield. But knowledge is power. Knowing which painkillers to avoid isn't about living in fear. It's about living with clarity, safety, and dignity. It's about asking your doctor the right questions, reading every label, and understanding how even small choices can protect you or someone you love. And perhaps most importantly, it's about sharing this information. Because so many seniors are still in the dark, taking dangerous drugs simply because they were never warned. So now, I ask you to do 3 things. Subscribe to Life in Words for more essential tips that every older adult should know. Like this video if you learned something new today, and share it with someone you care about. A parent, a friend, or even your caregiver. It could make all the difference. Together, let's rewrite the story of aging, not with fear, but with strength, wisdom, and the power to make better choices, one pill at a time.